In this video, we'll learn about adrenal insufficiency. Adrenal insufficiency means there is a insufficient production of adrenal gland hormones. Adrenal gland hormones, if you recollect properly, adrenal cortex produces glucocorticoids, mineralocorticoids, and sex steroids. So when I tell adrenal insufficiency, mainly we talk about adrenal cortical hormones. Okay, glucocorticoid is cortisol, mineralocorticoid hormone is aldosterone. So these two hormones are defective when I tell adrenal insufficiency. So now there are two main types. Okay, one is primary adrenal insufficiency, that is your Addison's disease, versus secondary adrenal insufficiency. So what exactly are these two, or what are the differences between these two, we'll see here. Primary adrenal insufficiency is known as Addison's disease, and this happens when the problem lies within the adrenal gland. So just remember this, see this diagram here. This is the adrenal gland, here is the pituitary, and just above that is hypothalamus. We all know hypothalamus releases corticotrophin releasing hormone that acts on anterior pituitary to release ACTH. ACTH acts on adrenal gland and finally produces cortisol and aldosterone. So now when the problem is in the adrenal gland itself, that is called as primary adrenal insufficiency or Addison's disease. Here the adrenal gland is damaged and that is not able to produce enough hormones, and the most common causes are autoimmune disorder and tuberculosis. Now, when I tell secondary adrenal insufficiency, it means it occurs when the pituitary gland fails to produce ACTH, because when ACTH stimulates adrenal gland, that is when all these hormones are released. So now when the adrenal gland is not receiving any stimulus from pituitary, the insufficiency is secondary to something else, not the primary problem in the adrenal gland. This means what? When in a secondary adrenal insufficiency, the problem is not in the adrenal gland. Okay, adrenal gland is intact, but they are not getting enough signal from ACTH or pituitary gland to produce these hormones. Now remember, in primary adrenal insufficiency, both cortisol and aldosterone are defective. As happens in Addison's disease. But in case of a secondary adrenal insufficiency, okay, as happens in pituitary tumors and all, ACTH is not released to stimulate adrenal gland. The only defective hormone is cortisol, because aldosterone levels will be usually normal in secondary adrenal insufficiency, because aldosterone is primarily regulated by renin-angiotensin system. When BP is less, renin is released from the kidney that comes and acts on adrenal gland to produce more and more aldosterone. Okay, so angiotensin 2 is a potent stimulator of aldosterone, not ACTH. So that is why in case of a primary adrenal insufficiency, both cortisol and aldosterone are less. But in case of secondary adrenal insufficiency, remember cortisol is less, but aldosterone is normal, because the adrenal gland is able to produce by the stimulus which is coming from angiotensin 2, that comes from renin-angiotensin system. But remember, for both the conditions, they require lifelong replacement with cortisol. But in case if it is a secondary insufficiency, then only cortisol replacement is sufficient.